Wasn't that beautiful? Jeff Hansen and his parents, that was an amazing keynote. Okay, so I am going to go ahead and ask the three other psychologists who are on the panel to come up and have a seat on stage. And I will introduce them as they come when they get here. Thank you. Come on up. And I wonder if we could actually, is it possible to get another microphone? Thank you. So one of the things that we wanted to do was have a panel of experts in coping skills up here to talk about the work that they do. We planned it so that each of us would talk for just a short couple of minutes about the work that we do, and then we would leave the rest of the time for questions from you all about any of the topics that we touch on or anything else related to coping with NF. So I will start by introducing Karen Walsh, who's sitting right here next to me. She's a neuropsychologist at Children's National Health System in Washington, D.C. She has expertise in the neuropsychological testing of children with NF1 and the associated learning disabilities and cognitive challenges that many of these kids face. She also leads the neurocognitive committee of the RAINS group, which is the response evaluation in neurofibromatosis and schwannomatosis. And they've done a lot of work in that area of defining what measures are best to use in testing kids with NF. So Karen Walsh. Anna Maria Franciano is a psychologist from Massachusetts General Hospital and Harvard Medical School, and she has published a lot of articles and doing a lot of work right now in mind-body health and mindfulness and other cognitive behavioral interventions for individuals with NF1, NF2, and schwannomatosis. And then at the end here is Lisa Coyne, who is a psychologist also in Boston at Harvard Medical School, and she also is involved in the ACT Institute in Boston and does a lot of work on early parenting, early childhood. She actually wrote a book. Boy, I sound horrible. I'm sorry. It just sounds so awful listening to myself. It's worse when you get a microphone in front of you. And I wanted to find the name of the book, Lisa. Yes, her book is... Go ahead.
Let me help her. It's called The Joy of Parenting. I didn't name it. I don't like that name. But it is actually a nice book. And I hope you go look at it.
It is a very good book. I've read it. So I'm going to... Lisa, while you have the we'll let Lisa continue now and talk for just a few minutes about what she does, about the work that she does and how it's relevant to coping skills.
Okay, and I have some slides. But if we don't have them, or if they don't come up, oh, they do. Okay, good. So what I do is I'm a psychologist. I've worked with children and families for many years. I also have 2 children of my own. And currently I run a clinic for children with a different kind of issue, very severe OCD. So we work a lot with coping skills with kids. And I have to say that I have not been to an NF forum before And I'm really touched by everyone that I've met. You're a really beautiful community. I hope that you get that. I hope that you know that. And it really resonates with some of the things that I teach. I do an approach that may be something you've heard of, it may not. It's called acceptance and commitment therapy. And we focus on what we call flexibility in life. Flexibility to do the things that you care about, even in the face of great adversity. So what we teach is sometimes when we move towards those things that we really care about in life, there are certainly real challenges, real physical challenges, health challenges, financial challenges, time challenges. But there are also the challenges thrown up in our own minds. Challenges like, thoughts like, I can't. I was very moved by the previous talk because one of those thoughts might have been, I am Claude and I can't. And that didn't happen. So the approach that we teach is how to become aware of the thoughts and feelings that get in our way when we move towards those things that matter, how to hold them really lightly, and how to move forward anyway, based on what matters to us, on what we want to do, on what we really care about. The talk about the dash is all about that. What do you want your dash to be? In ACT, we talk about that as your value. So mine, one of them, is to be of service. And so I can choose to do that, even if I'm tired, even if I don't feel very well, even if I think I can't, even if I think it's just a small thing and it won't matter to anyone. And yet, I try and do it anyway. So that's sort of the approach in a nutshell.
So I'm Anna Maria Vrancianu, and I have been working with patients with NF for over 3 years now, doing mind-body interventions, primarily through Skype. I see a couple of familiar faces here. The program that I developed is called the Relaxation Response Resiliency Program, and I've worked in incorporating NF-specific stressors. The program has, as a goal, improving ability to cope with stress and medical symptoms. It has relaxation strategies, adaptive thinking, concepts from positive psychology, learning to use humor, optimism, learning to identify stress warning signals, and the goal of this program, as I said, is improved resiliency and ability to cope with stress. And what's really interesting about this program is it not only improves quality of life and ability to function, but recent research has identified that it actually leads to changes at the level of the genes and brain structures that can really help you become more resilient, more better able to cope with stress, buffer the effect of stress, and adjust to having medical symptoms like NF symptoms.
Hi, I'm Karen Walsh. So my approach to helping families and patients with coping is slightly different. I'm not a therapist. I'm a clinical neuropsychologist. So I come from a different side of things a little bit, and these ladies have really wonderful programs to follow up. But I think the place that I help the most, so my job is really to evaluate children, primarily around cognition, and find their strengths and weaknesses. And I think that I'm often find that our interviews and our feedbacks with families are very therapeutic in talking about hope and talking about to use what you have and to identify barriers and learn how to move them, work around them, jump over them, and continue to progress forward. So I think that my question for families when they leave my office is, do you feel like this all made sense? And do you have hope for moving forward? And if their answer is yes to both of those things, I think we've started a really great relationship. And we often follow kids throughout their lifespan and really identify how these strengths and weaknesses manifest differently, which I'll talk to you about if you're in here in the next session. And so I contribute to sort of that coping approach to life in a little bit of a different way in terms of identifying. People come to find out what's wrong, but I often say, let's figure out what's right while we're doing that so we can utilize those strengths to move forward. So I look forward to talking to you all about this some more.
And again, I'm Stacy Martin, and I work at the National Cancer Institute of the National Institutes of Health, the NIH, in Maryland. One of the things that I do a lot with people with NF1 and other medical conditions involving pain is I work on coping skills, coping with pain, and I also use an acceptance and commitment therapy approach to that as well. I've done a couple of one research study that I just completed and another one that's getting ready to ramp up that I'll talk more about. I'm going to be speaking a little bit later this morning on pain specifically. And the other thing that I've been working a lot in recently is with individuals with NF1 who are kind of in that transition period from adolescence into adulthood. That can be a really challenging time for all of the grown-ups in the room. We all went through that time, and we remember maybe how challenging it was for ourselves. And certainly parenting a child in that time is challenging enough, but when you factor in a chronic medical condition, it can be even more challenging in terms of, what's an appropriate level of responsibility to assign to my child, and how are they going to cope with these increasing demands of adulthood when they have perhaps some limitations or some things that make it more difficult for them than someone without a medical condition. So those are the kinds of things that I've been working on. And really the idea was that we wanted to just kind of open it up to discussion and questions from the individuals in the audience to see, what kinds of things you might be struggling with or your child might be struggling with in terms of how you cope with the many, many challenges that you all face. So I don't know if it would make sense to pass a microphone around, perhaps, if anyone in the audience has a question, or if you can, what is the word? When you project your voice, which I cannot do right now. But does anyone have a question? Otherwise, we can. Yes.
With maybe a sibling that has NF to a sibling that doesn't have NF, how they can cope with what the other children are going through.
Yeah.
So I want to make sure I got all of that because I heard half of it. You wanted to know what would you do, how would you help a sibling?
A non-affected
sibling.
To
Right.
cope with all of the changes and all of the experiences that the family is dealing with when dealing with an affected child.
I think that's a great question, and actually we've done some research on that, not with NF communities, but with parents raising kids with a non-affected child and an affected child in with other disabilities. And one thing I think that is helpful that we have found is parent openness. Openness to questions, openness to discussion, openness to and acceptance of all of the many things that might be going on for that non-affected child, in terms of kind of how the family resources are balanced and things like that. So just having a sense of openness and warmth about that and making it an open forum for the child to really talk about what their worries are and what their concerns are, and also to facilitate the strengths, what their role is as, the sibling who might be able to help and support, but also who might need a break from helping and supporting when they need. Does that make sense? Yeah.
And I'll just add to that I think it's really important for the siblings to be aware of the fact that it's normal to have some feelings of resentment sometimes, like maybe the sibling is getting all of the attention sometimes, or it seems that way, and so they might have some feelings of resentment from time to time. And if the parents deal with that in a punitive way and are like, you shouldn't feel that way, that's not helpful. But if you're saying, yeah, course, man, that's really tough to have this other sibling who's getting so much attention and they get to do so many things that you maybe don't get to do. Of course you're going to feel that way, and just let them know that that's normal and that's okay to have those feelings. They just don't necessarily let the feelings control them.
And that, just to piggyback on that, because Stacy and I actually use the same approach to teach perspective taking. What might you feel like if you were your sibling? You know, I think that that's a really useful skill, and that's exactly sort of what she's talking about. And helping, and that's a skill that kids learn developmentally. They get better at it when they're older, and it's not a skill that we always practice, but it's actually something that you can teach in your family, even with younger kids, by doing things like, if I were you and you were me, what would I be thinking? You know, or if I were you, or if I were in your shoes, you can model. If I were in your shoes, I would feel just the same way. And, you know, I might even feel a little bad that I feel that way. Do you ever feel like that? You know, and it's a nice way to start those kinds of conversations.
I also have laryngitis, so I'm sorry if I gave it to you. I'm Linda Keller. I live in Chicago, and I have a question about, I have two daughters, one that is 6 with NF1. So far, she's doing fine. She has optical gliomas. And then I have a second grader who does not have NF1. And I don't know how to tell them, and I don't know how to tell them, and I don't know when to tell them. If there's any advice on how I could approach that. I understand that everyone in this room that has someone affected doesn't know what tomorrow will bring. Things can change, hormonal things can change, but for now she has optical tumors. They actually did shrink, so we have 1 MRI a year. But she's starting to notice she goes to the doctor more than others, and I just don't know when and how to tell them.
Well, one thing I'll say to that is that when you start the process of teaching them about their diagnosis, you don't have to tell them everything at once. You can start out with just a few simple pieces of information, like the name of, this is something that the doctors know that you have. There's something called NF1, and just a few pieces of information about what's relevant to her now. You said it's your daughter, right? Your younger daughter. She's a 6-year-old. Okay. So, you know, and to be open when she comes to you with questions. Well, what does this mean, or what does this word mean? To be honest, you know, and give her the information at an age-appropriate level. And if there is a psychologist that's in the medical facility where she's seen, they often can help with that process.
I'm very fortunate to be in Chicago with Dr. Listernick, who is one of
Yes.
a very well-known doctor. So
That's great. That's great. And to also know that it's okay to say, that's a really good question, and I'm going to get back to you on that. You can say that at times too.
Yeah, and I also want to add that a lot of the times children are doing better than the parents. So I think it's really, really important. Yeah. In fact, research has shown that parents rate the quality of life of their children worse than the actual children. So I think it's important to take care of yourself and your own stress, in addition to obviously caring for your family.
very happy. She's a happy girl, and I need to realize every day she's so happy, and just focus on that for now is how I'm
Exactly.
handling it. Thank you so
Exactly.
much.
Stay in the present moment. Don't
Thank you.
think too far ahead.
Sure.
Absolutely.
For all the parents in the room, I have NF1 personally, and my mother, like you said, little steps at a time. I was diagnosed when I was 4.5. Was very, very, very open with me about it. First, she started with the optic glioma and the legally blind, and the name, and then the cafe au lait spots, and then the bumps, and gradually worked up to it. And sometimes, the older I got, she was more blunt and honest, and that her doing that helped me be able to talk about it and embrace my skin and not be self-conscious or shy. So I just wanted to let all the parents know that whatever you're doing, keep doing it. Because just as long as you tell your kids and you're open with your kids about it and don't hide it and make sure they're comfortable in their skin, keep on going. I just wanted to let you all know that. That's all.
Thank you.
That's great advice, yes.
I just want to piggyback on what she said. My child is now 30, so he's not really a child. But he was first diagnosed at 18 months when there was no CTF. Back then it was a national foundation, and now I forget the rest of the name. And there was just a bulletin board, and my baby, when I joined in 2001, December 26th of 2001, he was 16. But yes, there's a light at the end of the tunnel. Listen to your medical team. They're great resources. Have a sense of humor. And he has a plexiform. He was called Monster Baby Freak from the time he was 18 months. If you ever want to know the story, just call me. I'll be glad to talk to you for the rest of the day about it. But there is a light. They get through. He's happy. He was in numerous newspaper articles growing up because he had NF, but NF did not have him. So I just want to piggyback on what she said to all of you, because like I said, my child is now 30.
I know we're getting to another question, and while the mic is walking, I just want to say I think the same applies to the cognitive piece of things. So if your child is one that does have some cognitive difficulties, we have the same kind of conversation about, when and how do you introduce that? Because I think, again, as children get older, them knowing about their disease and their strengths and limitations is vital, because that's how they learn to advocate for themselves. But it all has to be developmentally appropriate, right? You're not going to tell the 6-year-old everything you know. So we work with families, too, to figure that out. But often they will ask you, and you can trust your instincts, and your kids' instincts often helps you work through that. And if you're feeling like you want to say something and they're not really asking, you might just wait, right? Because they will ask you, just like kids say and do all things when they're ready.
Go ahead.
The mic.
Okay.
Oh, sorry.
I have a question about neuropsych evaluations as to when would you recommend to be the first age to get one, and also how often do you recommend repeating them and getting new information? That's kind of part one. And part two, how's the best way to share that with the school system or to use that in their educational setting?
Yeah, those are great questions. I think there's no standard, like by the time you're 3, you should have one. Often kids are recommended for a neuropsych or a developmental evaluation if they're younger, if somebody's noticing something that's concerning. We certainly know there are a number of risks in terms of cognitive development for kids with NF. That doesn't mean they all have difficulties, but we know there's risks for that. Early on, I think if you're noticing something early on, we usually tell you to speak up to your medical team to say, I'm worried about the development of my child in this area, and they can help refer you to, because I think at least a lot of centers like ours, we have an integrated team. So definitely speak up if there's anything on your mind. And then if you feel like you're not getting a response to that, speak up to somebody else. I always say that your intuition is extremely valuable. You are going to know your child better than anyone else in the world, and no question is a bad question when it comes to development, because we also know that the sooner we can identify a problem, if it does exist, the better off we are in terms of the long term, because we can set a plan. And to the second part of that question, how often we'd see a child, is also relative to a couple things: the problem, and if there is one, as well as their age when they come in. So I'll often want to see kids probably annually for the early years, the early school years, because the brain is developing so much that the changes will happen very quickly, and things change. So from one year to the next, we're really getting a snapshot of time, right? And I'll talk in the next session about how we might not see things in kindergarten that all of a sudden show up in first grade, and why that happens. So that will drive some of the recommendations for how often we'd see kids. And then as they're getting older and kind of going off towards the college age, we really spread that out and eventually feel like we're probably pretty good. We know you well. We kind of know what we can do to be helpful. What was the second question? Oh, the school. Thank you. Thank you. By the way, this is called executive dysfunction that I'm having right now. We'll also talk more about that. So sharing with the school, that is a vital part, right? I mean, you've come in, you've spent a whole day with me, and I've tested your kid to the nth degree, and I write you this really long report with lots of information in it. We often say, schedule a meeting with the school, and this can be true whether your child already has special education services or this is something you're looking to develop. Schedule a meeting with the school and share the report with them, and then start that conversation. I know I'm more than happy, and most teams are more than happy to be involved with that with you. So if you feel unsure about that, we can be on the phone for calls. Sometimes we can show up at schools for those kinds of meetings to support you and to talk about what we found in the evaluation and what our recommendations are in the school setting and help you with other settings as well, because those recommendations will look a little different. But absolutely, it can be an excellent tool. Again, what I say to families is, do you understand this report? Because this is a tool for you to advocate for your child. And if you don't understand it, we need to step back a minute and have me help you use that tool adequately. Does that answer your question? Okay, thank you.
Can I just add something really quick? Is that, and there's probably people in the audience who can correct me if I'm wrong on this, that I'm not sure if it's NF Midwest or one of the NF organizations has someone that will call in to your school and talk to the school administration or the teachers and just to educate them about NF and what it looks like in the school. And so does anyone know if that's NF Midwest that does that or NF Mid-Atlantic? CTF does it too. Okay, I didn't know that. Thank you. So there are people that will help you do that, because sometimes there's such a lack of knowledge from the teachers and the school administration about what NF is, and especially if there isn't anything visible about the disease, well, you look fine, why is, so.
Go ahead.
Oh, sorry.
Having the situation like this in this conference has really been very encouraging, and I am so glad that you asked that question about when to tell your children. Mom and I's story is, Mom is 88, so we've been around this for quite some time, but Mom had never talked to her mother about it, so she had no information until her very later years. So when I was growing up, it was recognized we never talked either. So I had no information. And after I was married, my husband and I, a few years later, talking about having children, I still had no information. I grew up that entire time until my early 20s not knowing if I had it, because we never talked about it. And that was a very frightening thing. But I didn't want to make my mom feel bad either, that I had questions. So I would strongly encourage any parent to also tell the non-affected child they do not have it, because then they can make decisions based on that information.
Hi. I guess my question is more geared towards adults or middle-aged adults that have NF, because with my sister, I don't want to speak for her, but I kind of am, she didn't find out till late teens, and none of the symptoms really manifested themselves till 30s, 40s, 50s, and now. So there's so much still unknown, and I know that there's a lot of parents here, and I really feel like they're very lucky because they have so many resources available to them while their kids are young and growing up. And so they'll grow up with a lot of knowledge to help them with their emotional, psychological, physical, everything, which my sister didn't have the benefit of that. And I'm just wondering, for those middle-aged NFers out there, what are your suggestions, again, for coping not as a child or an adolescent growing up? And I'm sure some of it's similar in terms of coping, but it is different when you're an adult or a middle-aged adult still kind of learning about this disease and dealing with all of the effects of it and having to handle it as an adult. Just wonder if you had any suggestions.
Yeah, I think reaching out for support. So CTF has many resources. as part of my work, as I mentioned earlier, I developed a mind-body program for adults with NF1 and NF2 and schwannomatosis that I'm hoping to disseminate pretty soon and make it available. It's really important to develop the coping skills, acceptance of things that you can change or you cannot change, problem solving, using humor or positive psychology components, paying attention to what you're thinking, and if those thoughts are negative, trying to replace them with more adaptive thoughts. There are many, tools available out there, so it's really important to reach out for the help.
So I have a follow-up comment and a question. The report that you were talking about for the children when they're in grade school can be very important and very helpful when they go off to college, because having that documentation that they have a learning deficiency or learn differently will qualify them for help through the college, for note takers, for extra time to get assignments in, for all of that. And then my question is, as a person as a 46-year-old male with NF1, how do I tell if the problems that I am having as I get older are the typical problems of getting older, or are related to NF, or both?
This is a great question, and I'm going to give you a quick story about this. I work in a pediatric hospital, but I work in NF and I work with our oncology team. And I'm more than happy to see young adults, and now I've found myself seeing, I guess what we could call same-age adults as myself. And so I had a woman about my age come in who was actually a cancer survivor, so a little bit different, but the story will resonate with you. And she had exactly this question. She was very successful. She had a full-time job. She was not married, but she was, by all accounts, happy and doing well. But she noticed little things, right, at work, like kind of being a little forgetful, sometimes having trouble with focus. So she came in asking me, is this because of the tumor I had when I was a kid, or what? And so I did the interview with her, and she's describing all these things, and I'm thinking, well, you either both have real problems or this is very normal for you, because this sounds like my life. So I tested her, and of course there were mild things, and in essence, really, I don't think it had much to do with her history. It was very much being in her, mid-40s and kind of the stress of life, being very busy, having multiple demands. But it's an excellent question, because sometimes you don't know the answer to that. You can't tell. And it could be a little bit of the typical kind of, we're on the downward slope of being so efficient and, having it all together, overlaid by maybe some difficulties and exacerbated by some things that are associated with NF. So any of those combinations can be true, and I think that's where we can be helpful in evaluating children and adults to sort of try to figure that out. The kind of good news about it is it won't really matter what it's coming from, right? I mean, it's nice to know, and there's a curiosity about understanding that, and I think that's valuable. But in the end, I'm going to tell you to do the same thing about the problems with attention and working memory that I would if that wasn't related to NF. So the interventions and the approaches to dealing with challenges, again, whether it's a normal aging thing or something else, will actually be very much the same. So I think it is nice to parse that out a little bit just for an information purpose, but it's not going to change our course.
Yeah, I guess my question was more along, if there are tumors that are growing, are things that are directly related to NF, where an NF intervention is needed, such as removing the tumor, or might be a different course of action. So, and how often would you recommend as an adult having regular MRI scans to check for tumor growths and keep those in check? Thank you.
Sure. Well, I can't answer the MRI question as a non-physician, so I'll punt that unless somebody else on the panel wants to.
We're going to cover more of the medical questions in the panel this afternoon. Okay.
I am not going to get in trouble with that one. Thank you for asking, though. And in terms of a tumor that maybe is existing and growing and its effect on cognition, that is a different question. I'm sorry I didn't understand that that's what you were asking. And a neuropsychological evaluation can be helpful with that. In fact, again, with our brain tumor population, we'll see kids in particular or an at-risk person regularly and look for any changes in their performance with our testing to determine if we think that that's something that is in fact impacting your functioning. And that may then get fed back to the medical team to talk about whether there's an intervention that's necessary or not. It's a great question. Thank you.
Well, I just wonder if you have any advices on a frequent question. My son usually asks me, Mom, why I'm the only one having this problem, and also why I'm the only one having this disease.
Can you repeat your question?
Yeah.
Your son's asking her if you want.
He usually asks me this
Why?
question, why I'm the only one in the family having this disease and having all these problems.
Yeah, I think that's a really good question. And what I might do, how old is he?
15.
He's 15. What I might do is just talk with him about when you have that thought, what do you feel? What's going on around that thought? And I would look at, I think it's a really good question, and I don't think anyone has a great answer to why me, right? I think it's a normal, natural question anyone might ask when they are confronted with an adversity like this. And I think the more important thing is, acknowledging and accepting that that's a painful thought to have, and it must feel very isolating. What can we do to help support you by keeping you linked in with people, with a community? And also, is there anything about that thought that gets in your way of doing the things that you want to do? And I think, it sounds like you might be really angry, might be upset about, coping with this as well. And so just acknowledging and making a space, all those feelings are going to come up, and just making sort of a home that you can speak about these things, and sitting with the discomfort of not really knowing the answer of why.
Yeah, I just want to add that it's really important to allow for the room for the feelings. So allow your child to really express the sadness if it's present. As parents, sometimes we want to fix. We want to remove all the suffering or all the distress of our kids, but they can handle it. And once you sit with a feeling and you don't push it away, eventually it goes away. And after this period of grieving, he's going to be able to really focus on the coping.
I think one of the hardest things, just real quick, for parents to do is to sit with your child and just see them hurting and not have answers. And that is exactly the right thing. Just be with them and stay when they have that.
And what that will do is let the child know that it's okay to have those feelings, but it doesn't have to ruin their life. It's okay to have those feelings, and if they can feel safe to go to you and express those feelings, that's huge. Conrad?
I'd like to address the question. Do you have a microphone? Thank you. I'd like to address your question because as an adult living with an F and having children with an F, it's often that you have a sense of isolation. I'm the only one with these bumps, or I'm the only one I know with these spots, and nobody else. The key that we have found successful for our daughter, who's 13, and going through a stage of identifying self and developing self-esteem and confidence, etc. What we've done is, first of all, we started the Arizona chapter that had kind of died for the Children's Tumor Foundation. And we got involved in our chapter and met a lot of families with kids with an F. So what we do is we meet some of these families at like a pizza place that's got games. And so the kids meet other kids with an F, and they can go play and socialize. And we parents can now sit down, have pizza, and share our feelings and communicate with each other of what coping strategies do we use, or what healthcare problems do our kids have, or what are we doing to cope? So the key is get involved in your local chapter or local organization for NF and meet other parents with kids with an F and have your child meet other kids with an F. And that's very helpful that has been our success with our children. Is get involved, because one of the key things to having a big event like this is parental involvement and community. And so I can assure you that that will be a strengthening of the coping mechanisms for a child, is meeting others just like your child. So they start feeling a sense of community themselves at a young age and don't feel that sense of isolation.
And one of the great things that CTF does is we have NF Camp. And I am one of the chapter representatives from Utah. And I've actually been able to go in at camp and sit in just for a few moments when they have a question and answer session with the doctors. And a lot of the times I hear, I've never met anybody else like me until I came here. And they do establish lifelong friendships. CTF.org/NFCamp. Is that right, Tracy-Ann? And there are scholarships available. My house is 10 minutes away from the camp. Come find me if you're like... But you do. You put your kid on a plane, and or in my case, I'll just take him to the airport, and he'll be gone for a week, and they have a tremendous time. And that's another way. If you don't know anyone in your area, and then the campers, it's been great to see them go year after year. You know, what week are you going? I'm going the second week. Okay, then I'll go that week too. And they see each other, and it's a really great thing.
Another thing that CTF, that I'm working with CTF on right now, is developing an internet support group for parents of kids with NF. Was something I did some research on. And we got some good results from our study. And so I've been working with Pam Knight and some of the others from CTF to put together one that's not for a research study. It's just going to be available, and we're hoping that that'll be up and running by late spring, early summer. So stay tuned to the CTF website for more information on that if you're interested.
So will that also include just like feedback from CTF too? So I know it's great for parents to be involved, but it's really nice to have, experts kind of weigh in, and their opinion is valued as well.
Yes, that was one of the things that people said they really appreciated. We had some health professionals be involved in the study site, and so we are putting together a panel of health professionals that can kind of rotate being on call, so to speak, and so we can be available to give input and so forth in the website.
And I want to mention, for anyone who's interested, I am currently funded by CTF to conduct a stress management study for adolescents with NF1 and NF2. So if you're interested in that, I'd be more than happy to talk to you after this, and I have my card, and I can tell you how to contact to be part of the study.
So our son complains of itchiness all the time, and I'm not getting to the medical side, but how do we help him not obsess about that or get literally consumed by what's going on in his skin instead of, what are some strategies that we can use? We just don't know where to begin.
Lisa, do you have an idea about that?
Yeah, I think that some of the coping skills that I teach involve getting some distance from when you're really stuck with struggling with a thought or struggling with some emotions and spending all of your time focused on it. And what we do is we teach the kids to simple little strategies that you are not your thoughts, so you get some separation. So we teach them, I'll actually be teaching a few of these a little bit later in the coping skills panel. But things like noticing what you're doing with your thoughts and being stuck with them isn't helping move forward, and helping kids focus more positively on the things that matter to them, that they enjoy, that are fun, that are life-affirming and good, and taking tiny steps in that direction, even with kind of the difficult stuff that's going on.
Yeah, there probably will be more that's relevant to your question in the pain talk and the social skills talks later, as Lisa mentioned. So I think we might have time for one more.
I just wanted to add really quick to that. You can sometimes use distraction, right, of getting busy with something else in the hard moments with overfocus. It may not always work, but there are some techniques that are pretty simple, where you get the idea you can't do two things at once. You can't be sad and happy at the same time, right? So you some guided kind of distraction techniques can be learned by parents to help their kids get out of that moment and kind of break that cycle a little bit as well.
Yeah, and as a parent, using a lot of positive reinforcement, so maybe setting a small goal, you start with one time a day when you notice you're doing this, trying to do something else, and as a parent, really supporting and reinforcing, the positives. It's a process. It doesn't happen overnight. It's a long process, but it can be done.
I was wondering if you had any advice for encouraging, my son is 8, and I found that he's not always being honest about symptoms he might be having. For example, he went to the doctor and he had strep throat, and the doctor's like, I can't believe he's not in an enormous amount of pain. And he said to me, well, I didn't want to go to the doctor's again. We were having nosebleeds at school he didn't tell me about, and I think he's just tired of always going to the doctors and missing school and that sort of thing. And any advice to help him, be honest so that we can make sure we're meeting his needs?
You stumped us. I'm sorry. I have nothing.
Well, I think that, as a parent, you always want your child, you always want to know what your child is feeling if they're in pain. But I think that this also shows an element of resilience, that maybe it's okay for me to, feel pain and not necessarily pay attention to it. So I think as a parent, your job will be to differentiate, what are some things that he really needs to tell you, versus what are some things that he's showing that he can cope. And I think again it goes back to you as a parent and how you manage your own feelings and concerns.
And letting him know that it's tough. That's one of the tough things about having NF, and that's one thing that's maybe different about having NF is that you do have to do more doctor visits than most of your friends, but let's talk about the other things in your life that are really great, things that we can build on, your strengths, the things that are important to you, and the more that those are a part of his life, then maybe the discomfort and unpleasantness of all of the doctor stuff will seem a little bit less difficult.
I think so. I have a question. I'm right here again. Woohoo! One of the questions I have is, how do you cope as a parent? I'm just going to give you an example. So we are trying to figure out how to cope as parents together because I'm here and my husband's not, and a lot of that has to do with his, it's, if you're not here, you don't have to deal with it. So, sorry. So how do you cope as parents? How do you come together?
I think this is really, really, really important. And this comes up in other patient populations and families as well. And we're often, one of the conversations I very regularly have with families in my office is that everybody may need to cope in a different way within one family. And that makes it difficult because the way that you might need to process this and work through it and find support may be drastically different than your husband's or your child's. And trying to find the places, kind of trying to figure out how to be okay with everybody needing something different. This isn't his thing. This isn't what's going to help him. Now, it may be different if there's an avoidance that's creating more problems. That's sort of a different scenario. But, and I think that's not uncommon either. Being overwhelmed with what's going on, not knowing information, and everybody's personalities will play into that, right? Some of us are avoiders, some of us are just go-getters with problems, and so it all has to do with that. But I think finding, maybe the conversation is, well, this might not be the place for you. Is there a place for you? Is there a way that you can learn more that is comfortable enough for you for you to be able to process and cope in your own way, and sort of respecting how he needs to do that, as well as him respecting what you need, which is being more active, it seems like, and present and engaged with others. It is very difficult, though, and your child may then need a completely different way of coping, right? So it's very hard, and I think probably as a mom, you're trying to take on the responsibility of everybody's coping, including your own, because that's kind of what we do as moms, which makes it hard. But I think just trying to accept everybody's way and find their own place that they can find the support they need to move forward is the key. But thank you. It's very difficult, actually.
And just to piggyback on that, there are different kinds of coping too. There's sort of one called emotion-focused coping, which has to do with what do we do with all the things that we're feeling. And some people tend more towards using that. And then there's sort of problem-solving focused coping, right? Where you might want to share how you're feeling about something and just have it heard. And then, sometimes other people are like, well, how can I fix that? And sometimes if it's things that are really difficult, or if they are not fixable, those two things don't mesh. And so creating a communication structure where you can kind of say what you're feeling, and then if your partner says, oh, well, how do we fix that? I know my husband does this, so maybe I'm projecting onto you. But, we do a lot of like, I just need you to hear me. You don't need to fix it. I just need to kind of say this. I just need to get it out. Can you just listen? Because there's lots of other things that we can do. But I think, and then you maybe giving space for the other kind of coping too. But that would be my advice.
Yeah, something that works really well is this concept of a family meeting, and it can be the entire family, so children as well, and then also a time that you and your husband have to check in with each other to see how you're coping, what you need, because what you don't want to do is you don't want to make the NF, sort of your entire life or your child's entire life. So compartmentalizing a little bit and having that time where you share your emotions and share, where you are, I think it's really important.
I want to just encourage people. I know we're a little bit over time, and I want everyone to have a break. If there was a question that you had that you didn't get to ask, please go write it on one of the note cards outside so that we can hopefully get to it this afternoon, or feel free to come up to one of us, in between sessions and ask it then. I really appreciate your attention during this panel, and I want to thank the other members of the panel for helping out, and thank you all.